Joint Value is an integrated practice network of primary care physicians and hospitals, regional hospitals and national hospitals. And together we try to add value over the total or the whole patient's journey of inflammatory arthritis patients. We have 3 phases over the whole patient journey. The first phase is the early access to the hospitals. For patients with rheumatoid arthritis, it's very important that we treat them in an early stage because the outcomes become better. So what we did, we developed a digital algorithm that helps the general practitioner to pick up the right patient with inflammatory arthritis. Within that phase, we saw that we had an increased percentage of 40 to 60% of adequate referrals. The second phase is more adding personalized outcomes, adding more value to personalized outcomes. And what we try to do together with the ICHOM work group of inflammatory arthritis, we try to implement the ICHOM standard set of the patient-reported outcomes in daily practice, in our daily practice. And we started with the implementation of the PROMs in 2018. And what we see is that about 50% of our patients who had a quiet rheumatic biomedical disease still have complaints about fatigue, work participation, physical functioning, and overall quality of life. We also changed our treatment strategies. We implemented also strategies for work participation or fatigue or things like that. Our last phase is monitoring lifelong our patients on distance, and we conducted a dashboard, a digital dashboard, where you can visualize all outcomes, clinical and patient-reported outcomes. And we are able as doctors to see those outcomes on one visual dashboard, but also the patients. And we use them in the hospital to improve also shared decision making, but we also use them for house monitoring. So the patients are still at home, they fill in their outcome measures, and then we see, oh, it's okay, then we leave them at home also. So in total, the joint value adds value to early access, to more personalized outcomes, and finally also lifelong monitoring on distance. So I think the right care, the right place at the right time.